adequately attend to patients who are COVID-19 positive to protect themselves and also prevent a spread. The federal government has promised improved welfare of the frontline workers by signing a memorandum of understanding on the provision of hazard allowances and other incentives with key health sector professional associations. But how far does the insurance cover go? How sustainable is it? Joining us on the program is Professor Usman Yusuf, a medical practitioner and former NHIS boss. He joins us from our Abuja studio. We'd like to thank you, Prof, for joining us at this time. I must begin by asking you that before COVID-19, what was the policy for healthcare, the Nigerian healthcare worker?
Very much, Millicent. So, COVID-19 essentially is testing three things of all the healthcares of nations across the world. Number one, the quality of the healthcare, the standard of governance, and the human capital. This is not something you can build in a day or years. And if any of these tripods is weak, it will be shown massively. And this exactly in developing countries, where the quality of our healthcare system is weak, governance has been a problem, and our capital investment has been very low. We will suffer a great deal. And that is why the emphasis has been on prevention, prevention, prevention. This is where we are today. And that's why you hear me particularly raising voices. Because I know what we have, I know what we can do, I know what we cannot do. The United States, in spite of all its economic prowess, is suffering the ravages of this virus. And then here we are. We must do the right thing. The right thing is understand that we are at war with an unseen enemy. And we must bring the fierce urgency of now that I honestly do not see. I have seen the numbers you've put on the screen, and I contest them. Lagos is not the epicenter of COVID-19. Kano is. Mortality is very high. We are not testing. That's why we are not seeing. WHO say the key to control is testing, testing, testing. And any map in the world that you do not see COVID-19, it is not because it's not there, it's an indication of lack of testing. So, we have a huge problem that we must address. Testing, testing, testing. Because that's the only way we can identify the patient. First of all, we've done what the right thing is. Initially, we seal the borders to prevent importation of cases. Then secondly, you will do what is called hard containment. That is testing, isolating positive cases, treat if you need to reduce mortality, do contact tracing. If you do not test, how can you find out? There are more cases in Kano than anywhere else in this country put together. People are dying. The way we can control this disease is be honest with ourselves that we have a limitation of testing. I mean, if we do not test, we will not see. People will continue to die.
The NCDC has admitted that much, Professor. But I would like us to talk about ensuring the healthcare worker. You listen to the president talk about signing an MOU on the provision of hazard allowances, and then, insurance policy generally for, these people who are on the front line. What is the policy before now? And do you think that, the provision of this hazard allowance is enough?
I don't know, to be honest, I don't know what the policy is. The Minister of Health will be the one to tell you that. I mean, where I've worked in the world, outside the world, you have life insurance, but I don't know what it is here. And the real issue is we have lost doctors and nurses to Lassa fever before. And their families have just gone, they've lost a loved one. In Aminu Kano Teaching Hospital, they lost 2 doctors, a very young house officer and a consultant. They operated on a patient and they died of Lassa fever. They were not covered. Now we have this pandemic that all over the world, the people in the front line are doctors and nurses and receptionists at the clinics. They are exposed to the highest doses of this lethal organism, and they succumb. I have a doctor friend, a professor who is laying in Kano, and the story is all over. The chief medical director of UCH also came down with it. And there are many doctors, especially our young doctors, who are in the front line. They are exposed to this, and the nurses that are at the bedside of patients. So it's a good thing the president is considering them and giving life insurance and increasing their hazard allowance, which is good. They fought the right battle. What I want them, and I told NMA and resident doctors, their real fight should be protecting them when they go to war. No soldier will go to Sambisa forest without a gun. So also, no matter how much life insurance or no matter how much hazard allowance you're given, if you do not have personal protective equipment, you are a sitting duck for this virus. You are exposing yourself. And WHO has said it clearly. It is the right of doctors, for every employer, every government, to protect doctors before they see patients. What's happening in Kano is this. Private hospitals are closing because they do not have PPEs and they are not equipped to take care of patients who have COVID-19. You take this patient to government hospitals do not have PPE. So doctors are not going to expose themselves and kill themselves. They have to protect themselves and protect their families and protect other patients. So governments all over this country need to provide personal protective equipment for doctors very urgently. It's not something that will wait. The president has said it should be done. We don't want to wait till tomorrow.
We appreciate your time, Professor.
And they are in the front line. Yeah.
Many thanks, Professor Usman Yusuf, medical practitioner, former NHIS boss. Thank you for joining us on the program.
I thank you very much too, Millicent.